We know that obesity is a major problem across this country, especially here in our state of Mississippi. For some folks, it's been a lifelong battle they just cannot win.
In this week's Medical House Call, Sherry Falk meets a woman who says gastric bypass surgery has changed her life.
Yo-yo dieting, losing and gaining weight, and health problems are things that Farron Morrell has struggled with most of her life.
Both sides of my family, we have a lot of health issues. Both sides are, pretty overweight and stuff. And so it's always been a struggle, in my life.
Weighing more than 300 pounds, it was a major surgery, gastric bypass, performed by Dr. Donald Balder 7.5 weeks ago, that is helping Farron ascertain her goal of living a healthier life.
I had high blood pressure, of course, and had plantar fasciitis, knee pain, and I've tried several diets that didn't work for me. I just felt like I was ready for a change and I wanted to get healthy.
So in the last 20 years, there have been over 4,500 publications that show time in and time out that once a patient reaches a certain weight, generally a BMI of 40 or more, which is considered morbid obesity, about 100 pounds or more over their ideal body weight, that less than 95% of people can lose weight and keep it off.
Morbid obesity is the largest epidemic in the state of Mississippi. Balder says these days weight loss surgery is comparable to hip or gallbladder surgery. Naturally, each operation has its own risk, but it's no greater than the risk of obesity itself.
And it's more often the case that if a patient continues their obesity track, they're at more risk to stay obese with the associated medical problems with diabetes, high blood pressure, high cholesterol, and so forth, than they are to go ahead and have surgery to eradicate the problem.
But it's more than just weight loss surgery. Balder put Farron on a food and exercise regimen prior to surgery.
It was just a long process. I had to see the doctor and the dietitian for 4 months. I had to eat properly and exercise, and I had to keep a chart of what I ate daily and my exercise. So it was a process.
The success with regard to weight loss surgery is highly dependent on what we teach the patients and the patient's long-term follow-up.
This surgery has changed my life. I feel good. I'm not taking blood pressure medicine anymore. My knees don't hurt, my feet don't hurt, and I'm just a happier person.
Farron's ultimate goal is to lose 100 pounds, and she's well on her way. At the time of our interview with her, she had already lost a total of 47 pounds. Now, as we said, she had gastric bypass surgery, which is the most invasive type. However, there are several other procedures to help people like Farron get themselves on the right track to a longer, healthier life. Stephen Carey, back to you.